Hi. Starting on slide 1, according to the Stanford School of Medicine, a 60-year-old librarian, Jane Clark, lives alone and only has her son David to rely on. Now, Jane suffers from Lou Gehrig's disease, also known as ALS. She was no longer able to take care of herself, and she did not want to put pressure on her son. She was not enjoying life anymore, so she discussed physician-assisted death with her doctor. I've done much research on this topic, and I have found very credible sources. Physician-assisted death, PAD, ought to be legal in the United States. On slide 2, some reasons to promote the legality of PAD include the relief of pain and suffering that physician-assisted death allows, the cost of fighting a chronic illness, and the right to life and liberty according to the Declaration of Independence. I understand that many people may have opposing views, but I have very dependable points to help you consider the legality of physician-assisted death. Continuing on slide 3. If your loved one was in so much pain to the point where they did not want to continue their life, would you want them to continue to suffer? I believe that this person has every single right to choose what they want to do with their life. The right instituted under the Oregon Death with Dignity Act says a mentally competent adult suffering from terminal illness likely to result in death within 6 months may choose to receive a lethal dose of medication after consulting with 2 doctors and waiting 15 days. Currently, the Death with Dignity Act has been effective for 23 years without facing correction or evidence of abuse, according to the Death with Dignity site. This law perfectly illustrates the guidelines that need to be followed and does not allow for just anyone to get their hands on this lethal dose. It is simple. If a sick person is facing so much suffering that they consider ending their life, it should be an option for them. Continuing on slide 4, the cost of fighting a sickness is damaging. The Milken Institute did a study on 7 chronic diseases: cancer, diabetes, hypertension, stroke, heart disease, pulmonary conditions, and mental illness. They all have a total impact on the economy of $1.3 trillion annually. No one would ever say that fighting a sickness is easy for anyone involved. It is ridiculously expensive to keep a person on life support, averaging to thousands of dollars a day in the hospital. That is not including medication or other treatment costs. If a person has no choice but to rely on life support, the cost goes up every day while a patient suffers more and more each day. The cost of suffering is expensive and should not be forced on a chronically ill patient. Slide 5, finally stated by the National Archives, the United States Declaration of Independence clearly states that every person has the right to life, liberty, and the pursuit of happiness. Having the right to liberty allows people to have the freedom to choose what they want to do with their life if it fits into the guidelines of suffering. This idea of having a choice and freedom to make your own decisions is guaranteed to every person in the United States from birth. Also, people have fought for other intimate matters like this. For example, from Briticana, the U.S. Supreme Court case of Casey versus Planned Parenthood further allowed for people to make their own decisions regarding abortion. And another example, actually, is the case of Washington versus Glucksberg, reevaluating this exact law of banning physician-assisted suicide, and decided it does not actually violate the 14th Amendment. These are great examples that show that people can and will always fight for what they believe in and should have a choice regarding their life and suffering. In conclusion, PAD should be legal in the United States. This is because of the relief of pain and suffering that physician-assisted death provides, the cost of fighting a chronic illness, and the right to life and liberty according to the Declaration of Independence. With the legalization of physician-assisted death, more people in the same situation as Jane Clark will have the choice to end their suffering. Thank you.